We know that since the legalization of recreational marijuana in Michigan, marijuana use has grown, and that's actually a nationwide thing. Now comes a study from the National Institute of Drug Abuse, which analyzed data from more than 280,000 people between ages 18 and 35, and it suggests that marijuana users thought about suicide, planned suicide, or attempted it more often than people who don't use it. In some cases, the incidences of suicidal thoughts were triple or several times higher than those that were non-users. Erika Alexander is the Director of Quality Assurance for Oakland Family Services, which is a private, nonprofit social services agency here in Pontiac, which engages in a lot of substance abuse counseling and also deals with mental health issues. So they hit on both of the issues that we're talking about here. Erika, good afternoon.
Thank you for having me.
Was this a surprising study to you that are in the substance abuse counseling business?
I don't think it's particularly surprising. In general, we know that individuals with co-occurring mental health and substance use disorders tend oftentimes to medicate, self-medicate. So we see individuals with depression or anxiety oftentimes using alcohol or cannabis as a way to manage some of what they're dealing with. And then, unfortunately, we can also sometimes see the results of that substance use creating another problem, whether it's an increase in suicide thoughts or whether it's a job or personal relationship problem. So I don't think in general it's a huge surprise.
It's interesting that in this study, they don't come to the conclusion that there's causality here. They don't rule it out, but they don't say that cannabis use caused increased suicidality. They just saw that there was that they did seem to happen together. So is it that in some ways, do you think that people that are prone to depression tend to use drugs at a higher rate, or that this is a drug that can exacerbate maybe an underlying condition?
I think both of those could potentially be true. I think part of the reason that we can't prove that something is a cause is that the brain and individual functioning is so unique, and it's not something that we can say, you know, if we do this, then the outcome for all people is that. We don't have that type of black and white. So a lot of what we do is really working in what we call the gray, meaning all those areas in between very concrete ways of being. And so what we know is that for some individuals, they can use cannabis, socially. They don't have any type of mental health issues. They don't suffer any addiction-related issues. They don't have consequences. Mm-hmm. And we know that for others, they can use cannabis, and it can unlock predisposition or some other types of symptoms that may not have become unlocked in the brain if not for the cannabis. And so the real problem is that we don't know who potentially is at risk, and this is, right, I think, why we put a lot of our focus on keeping our young folks from trying cannabis and alcohol until their brain is really fully developed, which unfortunately doesn't happen until about age 25.
So let me give some numbers to our listeners here in this report, because they looked at two groups, those that were diagnosed with depression and those that weren't. And what was interesting, those that did not have depression, 3% had suicidal thoughts if they didn't use marijuana. So, that was kind of the baseline, was 3%. It doubles to 7% among non-depressed people that were non-daily cannabis users. It triples to 9% with daily cannabis users, and it's almost 5 times higher for those that are addicted to cannabis. So these are people where there were not indicators of depression, but depending on the increasing use of cannabis, they had they had a greater proportion of suicidal thoughts. A greater proportion of them had suicidal thoughts. That's pretty alarming.
Yeah, absolutely. It definitely is. And we see, we often talk about it in terms of like the chicken and egg, and that we don't always understand when someone comes to us for help, what came first. Did the depression and anxiety exist, and that made it more tempting for this individual to engage in misuse of substances, or was it the use of substances that triggered something in the brain? And as I said before, because everyone is so unique and the brain is unique, we can't always understand the cause, and we can't always understand or predict the outcome.
Right. Well, it is not a victimless situation, to be sure, which some proponents of legalization tried to tell us. And I guess the big takeaway, Erika, Alexander, is that we need more study, and that's something that we could all benefit from, to try to more clearly define whether it is the chicken or the egg here.
Absolutely. And because cannabis is still illegal at the federal level, it's been a lot more challenging for research to be conducted specifically on cannabis, because there's a lot of red tape that prevents that. So unfortunately, we don't have as much data as we might if the government were more willing to allow funding and research to be focused on cannabis.
Or to reclassify it as something other than a Schedule I drug, which would open that up. Erika, Alexander, I should, full disclosure, I have served on the board of Oakland Family Services for nearly 30 years, and we do a lot of great work that helps people with substance abuse, with mental health issues, children that are abused and neglected, and we appreciate you spending your time with us.
Thank you so much for having me. I appreciate it.
Erika Alexander from Oakland Family Services.